In this lecture, we're going to look at the kidneys and the suprarenal glands. So we'll start off by looking at the position of the kidneys and the suprarenal glands and how that position is mirrored onto the surface of the abdomen. We'll then explore their gross anatomy by looking at the position within the abdomen and their relations to other organs. We'll look at the kidney segments and their specific blood supply. We'll then look at the internal structure of the kidney and the suprarenal glands, look how the renal pelvis is formed, and that gives rise to the ureters, and we'll look at a few constrictions that they have along their course. We'll then look at the suprarenal glands vasculature, because that can be quite complex. So the kidneys are paired retroperitoneal organs located against the posterior abdominal wall, and they're really important in removing excess water, salts, and waste products from the body. They're important in that they maintain the correct balance of nutrients and chemicals, so maintaining homeostasis, the internal environment. The suprarenal glands also play an important role, and that's in supporting the blood pressure and releasing adrenaline, and we'll explore that through this lecture. So let's have a look at the surface anatomy of the kidneys and the suprarenal glands. Well, here, the best way to view the kidneys is posteriorly, as they are located against the posterior abdominal wall, either side of the lumbar vertebrae, really extending from T12 and L3, extending down from about T12 to L3. And we can see they're sitting against ribs 11 and 12. So if someone was to damage the ribs, they could then puncture the kidneys. So we can see where the two kidneys are positioned. This anterior view with the other organs in place is practically impossible to see the kidneys. But again, if we look at the posterior view, we can see both of the kidneys here, again associated with ribs 11 and 12, and sitting against vertebra 12, T12, L1, L2, and parts of L3. The right kidney is somewhat lower than the left because of the liver, the presence of the liver just pushing the right kidney down a touch. So some key facts about these organs. The kidneys, as I've mentioned, they're a paired retroperitoneal organ located between the transverse processes of T12 and L3. It's important in removing excess water, salts and waste products and maintaining the correct level of nutrients and chemicals in the blood, maintaining this acid-base balance and maintaining blood pressure by regulating the amount of water we have within our body. They pass urine to the bladder via the ureters, and then within the bladder it's stored prior to micturition. Each of the kidneys is surrounded by a tough renal capsule and considerable fat, perinephric and paranephric fat, which we'll see. And each of the kidneys is divided into 5 segments, with each of these segments supplied by a segmental renal artery. The suprarenal glands, which we'll explore towards the end of the lecture, these are located on the supramedial aspect of each kidney. So if we return the supramedial aspect, we can see the suprarenal glands are going to be located around about here on both of those kidneys, and these are intimately associated with the superior poles of the kidney. They have 2 parts, an outer cortex and an inner medulla, and as we'll see, these are highly vascular glands. So this is an in situ cartoon of the kidneys. We can remind ourselves of what we're looking at. We've got the aorta running down the midline here. To the right of the aorta, we've got the inferior vena cava. And we can see we've got some parts of the quadratus lumborum muscle. We've got psoas muscle here. We can also see a psoas muscle here. We can see the part of the diaphragm around here. We can see where the esophagus has been cut as it passes towards the stomach. And we can see that the kidneys have this substantial amount of fat surrounding them. On the supramedial aspect of each kidneys, we can see we have the adrenal glands. So that's a general overview. They're located between about T12 and L3. So this will be T12 and this will be L3. That's their approximate position, sitting in what's known as the paravertebral gutter. Just some depressions either side of the vertebral column. Posteriorly, as I alluded to in the previous slide, there's a series of relations. There's some nerves, some muscles, subcostal nerve, which we can see, iliohypogastric, ilioinguinal. And these are passing down here, subcostal, ilioinguinal, iliohypogastric. We can see those posteriorly to the kidney. We can see it sitting on some muscles, the diaphragm, quadratus lumborum. It's also just sitting lateral to psoas muscle, which we can see here. Suprarenal glands sit on the supramedial border, and there's an intensive arterial supply from the aorta. Substantial renal arteries pass across to the kidneys, and the suprarenal glands also have considerable arterial input, as we'll see. Both of these organs, the suprarenal glands and the kidneys, are supplied by considerable fat, and this helps to hold the kidneys in position. The parietal peritoneum anchors them to the posterior body wall. They don't have a mesentery to suspend them. So they're surrounded by fat, which provides warmth, provides some protection, and it anchors them to the posterior abdominal wall.